good evening, depending on when you're watching this podcast. My name is Tumukunde Akofi, and I'm very pleased to be with you in this podcast as we're going to talk about gender equity in health profession. I won't be alone in the studio. Please help me welcome Dr. Jose. You're welcome.
Thank you so much, Apofi, for welcoming me. My name is Dr. Jose Mrechison. I'm a medical doctor by profession. I work at Rwamagana Level 2 Teaching Hospital, and also I work at Rwanda Women Doctors for Reproductive Justice as an executive director. And this is a network of female physicians which was established in 2021 with the aim of advancing gender, sexual and reproductive health and rights, and of course by empowering women to make informed reproductive choices.
Thank you very much, Dr. Jose. So for us who are watching and also as I'm hosting, please feel comfortable to watch us as it's going to be a sharing purpose and inspiration to many young women and girls as well. So starting from a personal journey, please, I feel very curious to ask you, what inspired you to be a doctor?
Thank you so much. To be honest, when I was in primary school, I didn't think that I would become a doctor. I was always drawn to caring people and helping them, but I didn't think that I would become a doctor. But when I started my high school journey, I always heard stories about healthcare providers, how they save lives, and I was like, wow, this is very cool and extraordinary. So I thought, I think from that moment, I said I should become a doctor or a nurse. Yeah.
Okay. And it's very nice that you are a young doctor. I think it's also inspiring to the young women watching. But did you know that you will end up becoming a doctor before?
Yeah, from that moment when I decided that I want to become a healthcare provider, I always aim to become someone in that field. So in my journey, like when I was in O-level, I love to learn more about biology, chemistry, and I remember that my friends used to tell me, no, don't go for difficult fields like MCB and PCB. But because I was very motivated and I really wanted to become a healthcare provider, I said, no, I should go for it. And I trusted myself, and then I believed that I could do it. Because I always say that if others were able to be able to make it, I can also make it. So that's when I said I knew I was always going to end up becoming a healthcare provider.
Okay, that's nice. So I have a question. Like, I see you're a young woman. So is there any hard part that did you face as in being a woman trying to pursue a medical profession?
Yeah, I wouldn't say that it was always easy. Of course, as a young woman, pursuing medicine, it was very challenging. But most of the time it was because of, gender bias. Because even like where I come from, they always told me, hey, how are you going to study medicine? That is a field for men. And I was like, no, I should study medicine because I love it. I was very passionate about it. And I thought, no, I could do it. I remember like in my Lulo, because I come from a little place called Nyaruguru district. Yeah, and like in the community, they always told me, no, you know what? We only know one person who studied medicine, and it's a male. It's not a female. That is not the profession for, for females. Yeah, so it was very discouraging, but because I was very passionate and I always wanted, to go for it. And also my parents supported the idea of becoming a doctor. So I said, I'm going to try my best. I will study hard and then get the excellent marks so that I apply for the university. And then I applied for it and then I succeeded.
Interesting story for her, but okay, I'll make sure I'll be inspired later. Make sure I have my medical profession later. So as we are watching, please feel comfortable. Feel free to ask me as well because we are sharing the purpose of knowing the gender equity in healthcare profession or health profession.
Yes.
So I had a question in between. So you heard many things. Many people told you you're a woman, it's for females and what.
Yes.
Did it have anything to affect with your mental health as a woman?
Yeah, at some point I started to doubt myself. I was like, oh, am I really sure that I'm going to make it? And also, you know, the fear of being the only girl in the room, like, it was very terrifying. So I started doubting myself, like saying, what if I don't make it in the end? What if what they are saying is true? And it was very challenging for me. I thought, what if I just changed the career? But then I was very inspired with another female doctor because I was able to talk to her. And then she told me, hey girl, it's very easy. Look at me, I did it. You can also do it. So that was very, very motivating to me. And it boosted my mental health and I was very able to pursue medicine. Yeah.
And most of us fear to pursue the faculty because of the long term, the duration.
I know.
Many people say they take 6 years, others take 4 years. What can you tell to us who still fear the duration?
To the person or young women especially who want to pursue medicine, I would just tell you that you are brave. Just be confident. And then believe that you can do it. Because if others were able to do it, you can also do it. And that brings me like to ask you, like, what did you think of health professions growing up?
Being honest, what I thought about health profession. First of all, I thought of it as a section that requires a lot of bravery. That's one, because that's why I didn't choose it, but I want to right now. I want to. Maybe later I will. And second, I thought it's, of course, gender stereotypes, we hear of them, as I also heard some. I thought it's for some women who don't want to get married, who don't want to, have their flexibility, who doesn't need some edutainment in their lives, some part of it. But currently, as years could go, till now, I still feel like it's a very good sector. And I would also inspire other females watching us to try, go, learn, read, take some years within, meet some other women, get inspired. That's what I would say, as I'm also going to try.
Yeah, and for the record, I heard that you pursued MCB, right?
I did, in high school.
Yeah, so I expected you to have, applied for medicine and what. So did you not see maybe meet like some women doctors who could have maybe inspired you to become one?
I actually did MCB because of my parents.
Oh.
I didn't have a choice to choose the section right away. But I didn't even get to be inspired by many people because I was really passionate about communication and media, mass media as well. Yeah. So as I grew up, I came to join an organization working with medical doctors. So currently I'm getting inspired, but I even think to join maybe later.
Oh, that's nice.
I will join.
Yeah, you should, because this is a very nice field, and we really need young people like you to join. Yeah.
Okay, that's nice. And then that takes us to the gender equity in health, like the main thing that we're talking about today. And I would love to know, should we consider gender in health professions?
Yeah, exactly. Gender equity in health profession, to me, it means a lot. It means that everybody, irrespective of their sex, gender, or background, should have like equal opportunities being in education so that they can contribute meaningfully to the health care. So it's just not only about numbers, but exposing especially women to be able to pursue those so-called male-dominated fields. Because it's not about that they can do it, but most of the time it is due to the social norms and, limited mentorship and also not getting a lot of exposure. So when girls are inspired and they're exposed, I think they can make a difference and also increase the representation of women in healthcare. Yeah, so that we can address this gender inequity that is in healthcare profession. Yeah.
So thank you very much. And about that, you have mentioned some of your challenges as a personal level. So can you tell us a general or various challenges that some women and girls face during trying to pursue their dreams in healthcare profession?
Thank you so much for asking me that. I think the first challenge women face is limited mentorship. Being honest, that is speaking from the experience. Like if you're not mentored and guided, you feel lost. Like because if I didn't meet my role model and told me that, you know what, you can do it, I feel like I could also have dropped out or maybe switched to another field. But because I was inspired and guided, because I got the chance to meet the right person to show me the path toward becoming a healthcare provider, I think it helped me and it can also help others. So when girls or young women are not having mentorship as they should be, there is a very big challenge. Another thing I would talk about gender stereotypes, because every people, especially in rural places, they say that no, that's a male-dominated field. And I'm not even talking about medicine only. I'm also trying to focus on STEM fields because it starts in the high school. So when women are not motivated to take up STEM fields, that means science, technology, engineering, and mathematics. So when they say that those are for male-dominated fields, you're not going to do it, that is very discouraging. So challenging gender stereotypes is one of the best practice that we should all advocate for to be able to increase or to remove the gender inequity. Also, another thing I would say is about information. When women or students at young age, when they are not provided with accurate information about the fields that they want to pursue, they are going to be lost. So we need to provide them with accurate information, show them the clear path, so that at early age, they know that, if you want to pursue medicine, you have to pass from this, you apply for science, then after science, you pass through all these steps so that we guide them so that they don't feel lost. Another thing that I would say is about being able to balance, family responsibilities and, the studies, because the society expects a lot from women. So when they are not able to balance that, they feel lost, and even their mental health, they face burnout, and they feel like health profession is not for us. And to be honest, it's not because it's not for them, but it's because the society expects a lot from them. So being able to balance all those two, it can also be very helpful towards removing this barrier of having gender inequity in health profession.
That's nice, and I have a few questions from what you have replied. First of all, I've heard you talking about the woman who inspired you. Do you have the right to know that woman? If yes, you can mention her. If not, keep it private.
Yes, that woman is a plastic surgeon.
Okay.
Yeah, I got the honor to meet her, and she really inspired me. She was like, I'm a surgeon, you see. And she's a mother, she has children. So I was like, if a mother of 3 children can be able to go and pursue and practice medical career, why can't I do it? I'm energetic and I'm still young. So I thought, yes, I should keep going for it.
is here on this?
Yes.
Okay.
Yeah.
You still want to keep it private? It's okay.
I don't want to make other fellow, doctors jealous.
Yeah, you don't need to lose it. It's okay.
Yeah.
So you've also mentioned, I've heard something called STEM fields. For me, I understand, but for the person who's watching needs to know what is the STEM field. The term STEM. Does it stand?
Yeah, STEM, it stands for science, technology, engineering, and mathematics. Usually they say it is a male-dominated, that they say that it's only for strong people. And it's not like they are going to carry heavy things or what. It's just, because of culture norms, they consider that field to be only for male, but it should be for all. That's why today I want to encourage young people, especially young women, to go for STEM fields, because it is very, very nice field, and you get to be exposed in many different things as you grow towards your career path. Yeah.
That's very interesting. And the last thing I'm asking you, I've heard you saying of some mentorship. I hope you help us guide through the mentorship, where we can get information for mentorships and related aspects that you have mentioned. So I hope you don't mind us taking a break, and
yeah, sure.
We'll get back to the main part of today's theme. So as you keep us watching, thank you very much for watching the first session before the break, and we're going to have a small break, and we're diving deep into the gender health in profession. Thank you very much.
Amarushanwa ku nkoranabuhanga yigisha ikinyarwanda, tumenye ikinyarwanda. Nshuti z'umuco n'ururimi kavukire, inteko y'umuco ifatanyije n'urwego rw'igihugu rushinzwe uburezi bw'ibanze mu Rwanda, REB, babateguriye amarushanwa yihariye mu biruhuko by'umwaka wa 2025, tumenye ikinyarwanda. Amarushanwa ku nkoranabuhanga ya telefone agenewe abanyeshuri bo mu mashuri yisumbuye. Iyi porogaramu tumenye ikinyarwanda iboneka kuri Play Store na App Store, ikubiyemo amasomo 6 y'ingenzi: ibisakuzo, indamukanyo, inshoberamahanga, amasano, ntibavuga bavuga, n'ikeshamvugo. Aya marushanwa ni amahirwe yo kwimakaza umuco nyarwanda, kwihugura mu kinyarwanda no kugira ibiruhuko bifite icyo bisigira abanyeshuri. Aya marushanwa azatangira kuwa 30 Nyakanga kugeza kuwa 28 Kanama 2025. Mu ntara n'umujyi wa Kigali hazatoranywa abanyeshuri 8, abakobwa 4 n'abahungu 4 bazahagararira buri ntara n'umujyi wa Kigali. Urwego rw'igihugu, abanyeshuri 4 ba mbere bazatsindira mudasobwa laptops. Naho abandi bageze kuri urwo rwego bazasura ingoro ndangamurage ku buntu, kandi banitabira umuganura w'abana kuwa 29 Kanama 2025. Banyeshuri, babyeyi, barimo, dushyigikira uru rugendo rwo kwigisha ikinyarwanda binyuze mu ikoranabuhanga. Twige, duhange, tumenye, dusigasire ikinyarwanda.
The Rwanda Basic Education Board Multimedia Production Studio is on a mission to transform education through technology. With a vision to become a leading multimedia production hub, the studio is dedicated to enhancing digital learning, fostering innovative educational content, and ensuring accessible, high-quality education for all.
It will also enable teachers to improve themselves and support each other's growth. We aim to bring this program to all schools.
To achieve this, the studio focuses on developing high-quality multimedia learning materials, supporting cost-effective digitization. By expanding and technology, the Rwanda Basic Education Board is shaping the future of education, making learning more dynamic, interactive, and accessible. The Rwanda Basic Education Board Multimedia Production Studio is on a mission to transform education through technology. With a vision to become a leading multimedia production hub, the studio is dedicated to enhancing digital learning, fostering innovative educational content, and ensuring accessible, high-quality education for all.
It will also enable teachers to improve themselves and support each other's growth. We aim to bring this program to all schools.
To achieve this, the studio focuses on developing high-quality multimedia learning materials, supporting cost-effective digitization, improving capacity, and ensuring learning continuity. By expanding broadcast channels and streamlining production, it aims to make education more efficient and widely available. The studio adds significant value by reducing costs, increasing in-house production capacity, and ensuring rapid content delivery through social media, television, and radio. From multimedia learning materials and live science experiments to edutainment programs and digital textbooks, the studio embraces a diverse range of content. Its delivery methods include pre-recorded and live-streamed programs, talk shows, documentaries, and sign language videos, ensuring inclusivity and engagement for all learners. Through innovation and technology, the Rwanda Basic Education Board is shaping the future of education, making learning more dynamic, interactive, and accessible. The Rwanda Basic Education Board Multimedia Production Studio is on a mission to transform education through technology. With a vision to become a leading multimedia production hub, the studio is dedicated to enhancing digital learning, fostering innovative educational content, and ensuring accessible, high-quality education for all.
It will also enable teachers to improve themselves and support each other's growth. We aim to bring this program to all schools.
To achieve this, the studio focuses on developing high-quality multimedia learning materials, supporting cost-effective digitization, improving capacity, and ensuring learning continuity. By expanding broadcast channels and streamlining production, it aims to make education more efficient and widely available. The studio adds significant value by reducing costs, increasing in-house production capacity, and ensuring rapid content delivery through social media, television, and radio. From multimedia learning materials and live science experiments to edutainment programs and digital textbooks, the studio embraces a diverse range of content. Its delivery methods include pre-recorded and live-streamed programs, talk shows, documentaries, and sign language videos, ensuring inclusivity and engagement for all learners. Through innovation and technology, the Rwanda Basic Education Board is shaping the future of education, making learning more dynamic, interactive, and accessible. The Rwanda Basic Education Board Multimedia Production Studio is on a mission to transform education through technology. With a vision to become a leading multimedia production hub, the studio is dedicated to enhancing digital learning, fostering innovative educational content, and ensuring accessible, high-quality education for all.
It will also enable teachers to improve themselves and support each other's growth. We aim to bring this program to all schools.
To achieve this, the studio focuses on developing high-quality multimedia learning materials, supporting cost-effective digitization, improving capacity, and ensuring learning continuity. By expanding broadcast channels and streamlining production, it aims to make education more efficient and widely available. The studio adds significant value by reducing costs, increasing in-house production capacity, and ensuring rapid content delivery through social media, television, and radio. From multimedia learning materials and live science experiments to edutainment programs and digital textbooks, the studio embraces a diverse range of content. Its delivery methods include pre-recorded and live-streamed programs, talk shows, documentaries, and sign language videos, ensuring inclusivity and engagement for all learners. Through innovation and technology, the Rwanda Basic Education Board is shaping.
Welcome back to the podcast again, and please feel free and you're welcome again. And I would love to remind you that we are talking about gender health in health profession. And you might wonder why we are women here. I think some people are guessing that question. And on my personal level, I would love to say that we are here to inspire the left behind women in the society, in the community. We're here to inspire them because, as they can see, it's also we still have a low number of women in the healthcare profession. So that's why we're here. So please don't feel like we're rejecting men, we're rejecting males in the health profession. And they're also inspired. I think some of them are even watching us. So please, dear males watching us, tell your cousins, tell your sisters, tell your little nieces and nephews, because we are also here to inspire them as well. Do you think that is important?
Yeah, it is very important, and I also think that engaging men is very necessary, especially when we are talking about gender equity, because they are the agents of change. They can support women and encourage them. Yeah.
Maybe next time we shall have a male host for them
True.
to feel inclusive. So as well. And I also remind you that please keep us watching on the RSEB YouTube channel, or it's Rwanda Basic Education Board, the YouTube channel. We are live on that YouTube channel. And also we keep on talking about the main purpose that we're here. In the beginning, you have mentioned that you work for Rwanda Women Rwanda Women Doctors?
Yes.
Rwanda Women Doctors, Reproductive Justice.
Yeah.
What is that? And please keep us reminded about Rwanda Women Doctors. What is it?
Yeah, thank you so much. Like I said, I work at Rwanda Women Doctors for Reproductive Justice. This is a network of female physicians. It was established in 2021 with the aim of advancing sexual and reproductive health and rights, and also advocating for gender equity. So we work on many different things, but all has the purpose of empowering women. So we provide trainings, and of course we work with healthcare providers. But as you can understand, that it is a network of female physicians. So we support healthcare providers to get the knowledge so that they can help us in advocating for different sexual and reproductive health services, including safe abortion, especially in the hospitals, because that service is being provided there. So we not only work with healthcare providers, but we also work with the general community, where most of the activities work them at Nyamata in Bugesera district. Yeah, so we support teen mothers to be able to get health insurance, but also keep educating them to get the comprehensive sexuality education, or within the line of preventing teenage pregnancy. Yeah.
So as I understand, is it a women-led organization?
Yes, it is a women-led organization.
You don't have male employees?
We have them, but it is a women-led organization. Yeah.
I could feel that it's not inclusive. Why you don't hire men as well?
No, we actually have men, even in our board of chair, they are included. And also when you're doing activities, for instance, if you are training healthcare providers, we train everyone, yeah, but we are empowering women so that they can also, we increase their representation. I think that's why we are also working on career guidance initiative. Yeah.
Career guidance initiative. That's interesting. What is it about?
So career guidance initiative, it is an initiative that we established in 2023 with the aim of inspiring young girls to pursue medicine. So we, in Kinyarwanda they say, ija kurisha ihera kurugo. So as a network of female physicians, so we started with inspiring women to join medical field. But we are not only limited to medical field, because we are expanding it even to, to STEM fields. Yeah, it is going to be inclusive. Yes.
And my first question goes to you as, why did you choose to start from the medical field?
Like I said, in Kinyarwanda they say, okay, actually the idea came because we noticed that there were a different gender gap, especially in the medical field. Like when you are comparing the number of students that are enrolling in primary school, they are almost equal. But when you consider the number of students that are in the university, women, they are like 5 times less likely to reach the university. So and also like comparing the statistics of, doctors and healthcare providers that we have in Rwanda, we found that like around 58% like they are women in the healthcare workforce. But when you are going to consider those statistics in the medical field, we only have like 12.4% of women physicians, like women specialists, 12.4 women that are women specialists. You can understand that there are very few, and we want it to be inclusive. We want it to improve, the healthcare. So that's why we were like, what if we inspire young women to pursue medicine? But not only, inspiring them, but as a network, we sat and, tried to find out like what are the barriers that are enabling these women to pursue medical field. So one of the things that we found is, of course, limited mentorship. So we said if women, they are not mentored, they are not guided very well to be able to go for medical field. So what can we do? And also we found that another barrier was limited information. Most of the time, young women doesn't know like what is medicine. So we found that because they are not informed, maybe they are not encouraged to pursue medicine. Another thing was gender stereotypes, because like they said, oh, it is a male-dominated field. How are you going to handle the pressure of being a doctor? So that was also one of the things that discouraged young women. So after sitting and analyzing that, we thought of, introducing career guidance initiative. So we said, as Wonder Women Doctors for Reproductive Justice, we are going to implement career guidance. We are going to support young women. So our target group was the student from high school, because we believe that that's where the career path starts. Like when you are choosing the fields that you want to pursue in A level, it directly, gives you the clear path of your career. So we did most of the activities in schools. We went there. We conducted science fairs. So we went to the 6 schools: College, the Christelwa, Maranyundo. We also went to Butare Group Officieli, and we also went at Nyamasheke School, very far. Yeah, so because you can ask yourself, like, why did we even choose to go at Nyamasheke?
I actually have a question, like,
Yes.
delve deep into the journey, because I have a question. Is the right of the adolescent considered, or I'm worried that you might be forcing parents to force their children as well to join the medicine field. Is it consented, or it's willingly joined?
It's willingly joined, because like if you don't love it, you can't pursue it. So what we were trying to do was providing, information, and also when we went to those schools, because we went to different schools, I told you. So we went there and conducted science fairs. So we provided information, like we explained to them, if you want to pursue medicine, of course you have to be in science fields. That is MCB, PCB, and BCG. So we went there, and then we met those students because we thought they were the right candidates to be able to pursue medicine. And what was very surprising when we went there, people, like young students, they don't have a clue about, the careers in university. Because like, I remember one lady asked me, like, she was like, so like, if I have a blood group O, no, she confused, like, she was very confused. She was like, other people told me that if I don't have blood group O, I'm not going to be able to pursue medicine. And I was like, having blood group O, and it is not related. That's why it is. There is a lot of misconceptions that are around, pursuing medical career. And as Wonder Women Doctors, that's what we did. So we went there with it was a group of female doctors, and then we had a discussion with them. We showed them like the steps. Like if you want to pursue medicine, you pass from here, you apply. After applying, you are going to perform the exams that you have to do. There is a written exam, there is interview, and then when you ace the interview, you're going to go for medical field. But also because like most of them, they were like, so if I go for medicine, will I become a surgeon? Will I become a gynecologist? We tried to inform them because they were really not informed. And also, what we did in the science fairs, we tried to break, to challenge those gender stereotypes. Because most of the ladies, especially I remember, I don't know if it is related to the place, but almost all ladies from Nyamasheke, they were like, no, we can't go for medicine. It's going to take a long time, and we're supposed to get married. So how am I going to get married when I go for medicine? So we try to, to educate them and inspire them, telling them that, because like I told you earlier, even the woman who inspired me to become a doctor was already married. So she was able to balance everything. So we also told them that, you know, pursuing medicine is not going to stop you from getting married, because not all doctors that are single. Yeah, so it doesn't, it's not related. It's just, you know, culture norms and myths that people have around in the communities, but it is not really related. So we try to open their mind, support them, and of course, those who were willing to pursue medicine, who showed interest, we did the WhatsApp group. At every school, we had the focal person who were in the WhatsApp group, and then the interested students joined the group, and then we kept mentoring them. We kept bringing people, successful people in medical field, to inspire them, and also, of course, to encourage them. Because sometimes you start doubting yourself, but when you get the right person to tell you that, you know, you are almost there, to encourage you at every step, you can do it. Also, what we did sensitization. We not only did science fairs, but we also went on the radio. On the International Science Day, we went there. We tried to bring the right about how women can be, you know, encouraged to pursue STEM field as well as medicine. Yeah, so, and I think that was very, very helpful, because even the students who were not able to reach out to us during the science fairs, because we only went to 6 schools, so we're not able to reach to all public schools as we intended to do, as we wished. But we kept doing, you know, online mentorship. That's we say, like, maybe if we go to radio, you know, radio is heard by, you know, many people, even those in low areas who don't have smartphones, at least they have access to radio. So we went to radio and then kept promoting about our initiative, and we encouraged young students who wanted to be part of it to be able to join it. So one of the things that I'm very, very happy about it is that we're able to develop what we called entry guidance manual to medical field. As you can see, I have it here. It is a very small handbook. I can give it to you, maybe you will check it. And those who are following us online, we can provide you the soft copy, because we also have it. That handbook is Entry Guide to Medicine. It has everything that you need to know about medicine. Like, what is it? And what is medicine? What are the requirements of pursuing medicine? What are the eligibility criteria? Because not every student is going to go for medicine. It has the whole step. Like in your application, what is it going to happen? And because we know that medical field is very competitive, we were able to develop mock exams, because nowadays, when you are applying to go for medicine, you have to go under 2 tests. Like you have to pass 2 tests. There is a written exam and there is interview. So with the written exam, we have prepared mock exams, because most of them, they use UK cards, and depending on our schools, most of the students were not exposed to those kind of tests. So when they join our mentorship within this career guidance initiative, we help them. We give them the test, they practice, and then we help them, keep encouraging them, keep, you know, providing different information. And also, when they pass the written exam, we help them through the interview. Because as someone who did the interview, I know like what they will be asking you. But I remember, like, when I was going to do the interview for medical career, it was nerve-wracking. It was my first interview, And I didn't get really the exposure of doing interviews. Like I told you, I'm from a rural place, and I wasn't exposed before. I was very, very nervous, and I couldn't even find someone like to help me, like ask me, like, you know, they might ask you this and this. You have to go. Did you ever see someone like going for an interview wearing jeans?
Yeah.
Yes, because no one told her or him. Yeah, so that's what we are trying to do. We prepare them. Because I feel like because I didn't get the opportunity of having someone to support me when I was preparing for, you know, for that interview, I couldn't bother my role model. I had at least the ability to find a YouTube channel. I asked, like, if someone is going for an interview in medicine, what questions I might expect. I think that's what helped me. So when I was really helping these young women, preparing them for interview, I remember the challenges. So I thought, no, if the young people want to go for medicine and I'm still here, and Rwanda Women Doctors is still here, we really need to support them. We really need to help them, you know, keep them encouraged. Because like when you're confused, when you are not getting guided very well, that's when you start doubting yourself, and then you feel like you can even give up. So we really need to support them. So we were lucky to have some of the students. We of course we reached to them, and we reached to 484 students, like within the science fair, and among them 167 they were able to do written exams. So when they went for written exams, we only got 58 who were prepared to go for an interview. So
58 passed.
yes. No, they didn't pass the interview because we were still waiting, but they did the interview.
Okay.
Yes, they did the interview. And of course, before doing the interview, we conducted a session for them to help them, you know, prepare them for public speaking skills, and also to navigate through the questions that they might ask them, like during the interview. Because like we are doctors, we know, okay, we didn't have like the, you know, the clear, or, you know, we didn't, it was not like we have a list of questions that were going to be asked, but we had a crew because we passed there, so we knew like what they can be asked about, so we're able to guide them and support them. So we prepared an interview session for them. We supported them, show you have to be confident, you have to dress well. You're not going to come wearing deshire or deshire in an interview, yeah. Because even in our profession as doctors, we don't usually go to the hospital wearing deshire. No, it's not like that. We must, yes, we have to be smart. Yeah, so we helped them, and also they were able to. We are still waiting. Very soon we will be able to announce the selected participants, and also, yeah, judging from some of the messages that we receive, we see that we are doing an amazing job. And also we recognize the issue that, you know, we are in Rwanda. So not all girls might have smartphone, not all girls maybe can come, you know, at our place or be able to join online sessions. But we have a toll-free line that you can call. It's 8016. You can call anytime if you wish to be, if you want to ask any question regarding mentorship, we can support you. It is always 24/7. There is someone to pick up the call for you and support you and respond to any question that you might have. So to all young people out there who want to pursue medicine, yeah, you have to be confident and you have to, you know, to keep being motivated, because I know that you can do it and we are here to support you. Yeah.
Wow. It was a nice story and interesting to know about our Rhodeman doctors and also career guidance. And please, for those who are watching, stay tuned on this YouTube channel because we're talking about something serious and really interesting for your sister and your cousin sister and everyone. So, coming back to career guidance, I have a lot of questions to talk about it.
It's fine.
You're not going anywhere.
Yeah.
And for us who are, those who are watching as well, and passing through the handbook, it is consisted of overview of medical field. This is a structure of the medical field in Rwanda.
Yes.
Yes.
Yeah.
For both private institutions and public institutions.
Yes.
And it is also made of the entry requirements. This is very nice. And also admission process, which is having 4 steps. I hope they're ready to pursue them.
Yes.
And it is also giving the financial considerations for those who want to join the medical field. And also the skills and attributes for aspiring medical students. This is very nice. And what the academic preparation and practical preparation. This is very nice.
Yes, for academic preparation, that means you have from MCB, PCB, or BCG, because they are very strict. They consider biology, chemistry, and of course, you know, for PCB, physics and mathematics. So you really have to be competent.
Yeah, sure.
Yeah, to be able to get the excellent marks, and then when you get excellent marks, they release the call for application. Then you submit your application, or if you want to go for University of Rwanda, or you can even apply for other universities. It is not limited only to University of Rwanda, because we have other universities that are, you know, helping students that have that faculty of medicine. Yeah.
So, as I'm lucky to have this, if someone else needs this handbook, where can he or she find it?
This handbook, we have a soft copy, and it is on our website.
On the website?
Yes.
Maybe you should share us the website?
For the website is www.womenrepro.org. You can find it there, and also you can write to us on, you know, X. Yeah, or even you can call us on 8016. Yeah, we can support you, we can send it to you, and yeah, we can share it to everyone who needs it. And also, talking about career guidance initiative, because I know that most of the young students who are following us, they might be saying, I maybe wanted to be a nurse, or I wanted to be an ophthalmologist, but they talked only about medicine. What I can add is that, you know, when you become a doctor, you can specialize in different things.
Yeah.
You can go for ophthalmology, you can go for, you know, surgery, you can go for orthopedics, you can go for gynecology and obstetrics, where you have to deal with mother's life, you know. You can go for pediatrics, yeah, and there is a lot of different specialties. So it is very broad. You're not going to be stuck. When you come in the medical field, you are going to see that there is a lot of, you know, opportunities out there, and there is, of course, many different specialties that you can pursue. Yeah, and also for maybe if they keep following our X and the website, they will see that in May we were able to launch this career guidance initiative. Yes, we were able to launch it, and we gathered students, policymakers, so that we can really keep inspiring young women to pursue medical field. And we are not only going to be limited to medicine, we are expanding. We are reaching in whole STEM fields, like even in allied health profession. We will keep inspiring people. If they want to become nurses, if they want to become radiologists, if they want to become dentists, yes, all engineers, and even technology, yeah. So we are not only encouraging especially young women to join medical field only, but in every health profession that they might be, feeling or might be passionate about. Yeah.
Well, thank you very much. But taking back to your slides or what you've talked about career guidance, I've seen a picture of one of the schools that you visited, and I have a curious question. Audience know we're talking about gender equity in health profession, and I might ask myself, like, are all these schools how do they call them? One-sex secondary school?
No.
Only so they're mixed?
Yes. You can see on the first picture here, there are males.
Okay, so
yes.
So if they're mixed, I want to know what is the message that you give to the boys who are also included, because I think they also need to inspire their little sisters in the primaries and the O levels.
Exactly.
So what do they tell them?
So engaging men, like I said, male or men, is a powerful tool, because if you are a boy and then you have a sister, instead of discouraging her that you're not going to be able to pursue this STEM field and or medicine, indeed you can be supportive. That's why we need to change even the perspectives of how male and men feel towards women pursuing medical field or even STEM field. Yeah, so that's why we are including men, we are engaging them so that they can help us to advocate for it, because we really need them to support women. Yes, because like imagine if you are in a class and then there is only maybe 10 girls in MCB, and the last 50 maybe they are male. So there is a possibility that those male students can be harsh or be like, why did you even choose this? Why did you not go for Hell? Why did you not go for Meg? Why did you not go for TTC education? Yeah, exactly. So that's why we really need even male to work with us so that we can make an inclusive healthcare workforce. Yeah, so that they can inspire their young sisters and to be able to increase the representation of women in healthcare.
Sure. We still have a question. Why does the majority of the schools that you visited are single-sex schools?
The reason why we started with female schools, it is because, like I said, tracking the number of the statistics of women who are pursuing medicine, it was very sad. So we're like, why women are not pursuing medicine? So let's go to the school and of course begin with female schools to ask them what are the challenges, because if they are at that school and they're the only girls there, meaning that if they are inspired and they are very well informed, we can get a large number of women pursuing medical field from that school. So that's why we started with single female school.
That's very nice. And also on behalf of the audience, I still have a lot of questions. And somebody can wonder, do you have a typical facilitation or support that you provide? Suppose there is a girl from Rulindo,
Yes.
and she wants to pursue medicine.
Yes.
And she's coming from a poor family, let me say so. Do you have any help that you're able to provide to that woman?
Thank you for asking that. Of course, if she wants to pursue medicine and then she comes from a rural place, that means, actually, when we talk about gender equity, we are trying to talk about how we can have equal access of opportunities regarding where someone comes from or regarding to sex and everything. So if a girl comes from rural area, we really need to support them. We have to consider maybe rural area, she was not exposed to, public speaking skills. So if she wants to pursue, that's the first step of helping her. We prepare her, we support her. We say, hey, even though you come from rural area and you didn't know that UK cards exist, they're there. We bring them the mock test to them so that they can practice and then they can, also become confident. And also, we are not asking them to come to our office. We go to them. So we have to go to them and then if it is not possible, like I said, we have a line. It's free of charge. They can call us anytime, and then we can keep supporting them. Yeah.
So, and about career guidance, how often is it supposed to take place?
So for now, we are holding like quarterly sessions because, career guidance is very broad. And what we wanted is to inspire young students at early age. Because in Kenya, they say, meaning that if you want to inspire them and if you want to help them like become clear of what they are attracted to, we really need to start earlier when they are, in primary schools. So in our first phase of our initiative, we went to high schools, but like I told you, we are expanding it. We are trying to see how we can reach to every student so that they keep being, inspired. We plan to go for different high schools, and of course, if the time and,
I don't think it's even necessary to begin at the ordinary level.
Exactly, because it is very necessary. Because at the ordinary level, it is where they are going to choose studying MCB, PCB, MEG, the A-level sections. So that's why it is very important. So at Rwanda Women Doctors for Reproductive Justice, we are not just sitting, we are trying to see the way we can keep advocating for it, and of course reach to many people, many students, as many as we can.
So it's such a great job for Rwanda Women Doctors. I'm giving a great shout out to the fellow staffs of Dr. Jose.
Yes.
And moving forward, and you've told us that you have launched the first edition of Career Guidance.
Yes.
And could you give us a short image? How was it? What did you expect? What were the outcomes?
Yes, so when we launched Career Guidance Initiative, it was in May this year, and it was really, to us, it was an achievement to see, like, we went to schools. We went there, we inspired young girls to pursue medicine. But then what is it? What is the impact did it have? Like, we were able to bring people, because not all people understand this concept of career guidance. So when we launched, we wanted to make sure that we are on the same page with parents, policymakers, and also with young students. And also we realized that even students who were already enrolled in medicine, especially in year one, like when you ask them, like, okay, you are already in medicine, thank God that you made it. So what are your aspirations? Do you know, like, what you're going to become after, general medicine? they were like, okay, we are not even sure, like, what is ophthalmology? What is, what is gynecology? Because in level 1, they are learning basics. So they are not yet went into the hospital and get like the, the opportunity to know what is being done in the hospital. So within our career guidance, when we launched it, we brought all those specialties because we invited medical students from year 1 at the University of Rwanda. So they came, and then we also invited specialists.
So it was year 1 students?
And yes, and high school students, yes. Yeah, high school graduates who were preparing to go for medicine. And what we did, we practiced like mentor-mentee program there. We said for high school graduates, we selected a few medical students. They were the one who inspired them, like clearly sharing with them what is the journey of being a medical student, what does it take, and
all girls.
Yes, they were all girls because, like I said, we began with girls, but we are expanding. We are not only going to be limited to girls, but we want to increase their representation. That's why we started with them. Yeah, so we also helped those students from medical, like from level 1. We facilitated them to meet the specialists. Like we invited, pediatrician, internal medicine specialists, or those who do surgeries, orthopedics, and even public health. Yeah, so we invited them, and then we joined them so that they can share exactly like the real testimonies and the real challenges and even what to expect in those specialty. Yeah, so that's what we are doing as Rwanda Women Doctors for Reproductive Justice. We are not only, encouraging high school students to come in medicine and then we leave them. No, even when they reach there, we keep following them. We keep seeing if there is anything else we can support them with. If they want to go for specialization, then we bring some people who are already specialized, like I said, from different specialties. We connect them so that they can keep inspiring them. Yeah.
That's interesting. And for the audience as well, please, they gave us the short code. It's 8016. Yes. 8016. And also feel free to visit their social media platforms. You have X, they have LinkedIn, you also have Instagram.
Yes.
And are there only 3? Or
no, we are
LinkedIn and Instagram.
Yeah, and very soon we are also going on TikTok.
Okay,
yeah, because we have
because
we have seen that young people they also use it a lot, so we need to keep them informed as much as we can.
That's really a nice job for Rwanda Women Doctors for Reproductive Justice. And also coming back to your mission, I feel like who else? Who are your partners? Because you can't do that job alone. And to know who or what do you need, either from government institutions, from different. And before you answer that, I also have a question. During the career guidance, and also we need to watch them. Maybe we can go for your website. Maybe you can see the video of how it was. Were there any parents? Because I think you really need also parents to help you motivate.
Yes. Yes, during the career guidance launch, maybe we ask later for the technical team to help us. Maybe if we can give a clear picture of how the career guidance launch was. But parents were there because we believe that we can't inspire young women only. We also need to involve their parents. We need to involve them because usually when they are not at school, they are with parents. So if parents encourage them and also guide them to choosing, a right path, it is very supportive. you know, because when you grow up and then your parent is like, yeah, you're not going to reach anywhere, you're not going to do this and this, it is stuck in your mind, and then you start to doubt yourself. So that's why it is very necessary also to integrate parents in our initiative. So we didn't leave them behind. They were also invited, and of course we even gave them time to, you know, to share their testimonies and to share their experience, and also how they think it could, you know, this career guidance can be happening. Yeah, so we integrated them, and of course we keep working with them because we can't do this alone. Like you said, we need partners. We need people to support us. So this should be a collaborative journey. That's why when we started, of course we worked with the Ministry of Health and the University of Rwanda, and also with other partners. And I think that today coming here at Rwanda Basic Education Board, this is very nice. I hope that in our future activities we are going to keep working with them so that we can reach too many students, because this was very helpful. Yeah, when students are informed and they are guided, they reach to where they want to reach. Yeah.
Interesting. And I would love to know about the 58 number that you
Yes.
mentioned. So you're expecting to know the final results of
Yeah.
who are supposed to attend the medical school.
Yes.
And I want to ask, what are the next steps to some of the 58, maybe even they can even be less? So what are the next steps of Rwandan doctors that are planning? What are the follow-up strategies?
Yes, at Rwanda Women Doctors, we are not going to sit. We are, of course, because we have a group, we are going to see those who were able to be admitted successfully, and then they will join our role model network, meaning that they are our champions. So when we start conducting other science fairs, we are not going to be the one to talk, because we have our product, we have the impact that we made. So they are going to help us to inspire others. So whenever we'll be going, they will maybe share the experience of how it was when we approached them, and how we supported them with their written exams and even preparing them for interviews. And I think this is going to be very crucial, because if you are part of an initiative and then you become the agent of change and you become the person to go to advocate, it is very understandable than me coming to tell you, you know, you have to pass through this and this. And also we have like testimonies. Some students wrote to us. I shared like a small text from them, because they were like, you helped us a lot. We were able to successfully pass the medical interview. So this is very encouraging to me. Like whenever I'm looking at these messages, and whenever I'm, you know, looking at how we are able to inspire young women, it is very satisfying to me.
It's really interesting, as I can see some of the messages, they're anonymous, yes?
Yeah.
Maybe the audience will zoom to watch this. And also, I would love to know, going back again, and is it stopping from there? Because I want to know, is Rwanda Women Doctors for Reproductive Justice able to work with the agents of change till the 6 years, like through the 6 years of pursuing the field?
Yeah, exactly, because when they join, like I told you, they of course they join role model network, meaning now they are role models. They are no longer mentees that we were mentoring, but they are our role models. They are going to inspire others. So we have a group, and we'll be able to integrate even their stories. We are planning to share them on our website very soon, so that every person out there can be able to see their journey, how it was through mentorship, and how they were able to achieve what they wanted to achieve. Yeah, so it is not stopping there. We'll keep following them up, and of course bringing new students in our network. And also another thing is that, good news, we are not going to be limited to medicine, but we are expanding. We are expanding to even in STEM field, and even in other allied, health professions. Yes. For last time, we launched an initiative to encourage young students to come in medicine. But for our next project, we are encouraging them to even join specifically STEM. So that means we will keep working. We are not going to stop here, but we are going to keep working to see that we can really solve this issue and increase the representation. That's why I'm calling out, to other, government and other stakeholders to join us, because we can't do it alone. But with a collaborative effort, we can be able to keep inspiring these young people. Yeah.
That's very nice, and a great much thanks to Rwanda Basic Education Board as we're hosting you guys. And also, I want to know, we're going to talk about key players in partnership with your mission as Rwanda Women Doctors for Reproductive Justice. And talking about key players, of course, I mean parents. So please make sure you bring close your parents, close to the screen as well.
Yeah, so that they can hear it.
Yes, because we're going to be specific what we need from parents in every section of this mission as Rwanda Women Doctors, and also through the mission of Rwanda Basic Education Board. So I would love to know, first of all, going back to your personal journey, pursuing the medical profession, did you have any parental guideline or parental mentorship, let me say mentorship?
Yes.
Or did you have any parent inspiring you to tell you, keep going, just say you can make it, you can do it, even before you as yourself feel like you want to pursue the profession?
Yeah, thank you so much for bringing that. I think being supported with my parents helped me a lot. Being honest, they didn't know also about medicine, and they didn't have like so many information because they didn't go for medical career. So they all went for public health and things like that, but they were not very sure about medicine. But even though they were not sure, they told me, you know what, if you feel like you can do it, if you love it, if you are passionate about it, we support you. Anything, just go for it, and then we'll be there for you. So that's why I think it is very necessary for parents to help us in this journey of career guidance. Because not even on the last step of choosing the career, but even on growing up. Because if you grow up looking at stories of successful women, maybe in medical field and other areas, it is very, very crucial, and it can help them to keep being inspired and also to direct them. Yeah, so we think that is very, very important for for parents to guide their children, to guide them throughout the process, but also encouraging them. Even if they can't have information about a certain career, but supporting them and connecting them with other people who might have certain information about those career, it can be very helpful. Because I once heard from, she's my fellow doctor, we work together at the hospital. She once told me, you know what, I want to go for my master's, and it's going to take 4 years. And my parents are reminding me, hey, we need grandchild.
Yeah, you're 25.
You're 25. So she was like, I'm really confused. But what I told her is that we have so many doctors who are married, and at the same time, they are studying, they are pursuing masters, they are, they are providing the service. So you don't have to be stuck and feel like it is not going to be possible for you. Indeed, you have to go for it if you feel like you want it. And if you get married and of course keep pursuing medicine, you are going to do it because it is very possible that you can balance it. We have so many examples of people who were able to pursue it and be able to balance their careers, and they were able to do it. So you can also do it. That's what I always tell them. So to parents, please, who are following us today, support your children, encourage them, and also connect them with the people who can help them. Yeah.
And I would love to know, was the support mutual, or maybe your mother was very passionate about inspiring you, maybe your dad wasn't that much concerned? Was the support mutual?
Yeah, for me it was mutual. Yeah.
So you had to obey your parents, It's very interesting.
Yeah.
So I would love to know, what do parents need in terms of how to address to their children?
So I feel like parents also need to be informed, because sometimes you are encouraging your young child to join medical field, for instance, or even STEM field, but you don't have a clue. That's why most of the time they discourage them. So if they are informed, it can also be crucial for them to be able to support them. Yeah.
So after that, I want us to be specific. So please, you are watching Rwanda Basic Education Board. Please make sure you save this video because your parent is going to need it. And I want to know, how do parents, so as we are inspiring daughters or young women, and I want to know, how should parents address to their young daughters? Like, what do they need? Of course, they need information, but
Yes.
addressing to a young female, it takes some cautious concern. So how should it be done as talking to parents?
I feel like it is very crucial that parents need to be informed, but please don't discourage your young doctors. Don't push them and pressure them. You have to get married, because I feel like this is one of the things that parents, most of the time, they are talking to their young doctors. You are old and you have to get married. If you're going to go for medicine, it's going to take 5 years, 6 years, and you're not going to be able to get our grandchild very soon. Please, parents, just know that you can do both. You can be able to balance it. And also, I would encourage parents to support young students to be able to go for STEM fields. Challenge that culture norms that says that is a male-dominated field. No, it is not. Even female are able and they can do it. So you really need to keep, encouraging them, and don't push them to study what they don't like. Yeah, indeed, support them and help them to be able to join those medical fields.
Yeah, thank you very much. And I was also talking to my parents as well. As I said, I was forced to do MCB, was it math and the chemistry? So also talking about men as well, please don't feel rejected, because we want to remind parents that you should also understand your young boys,
Yes.
of course, and males as your children as well. Divorce them,
Yeah.
listen to them, and just guide them with their passion.
Yeah.
And also coming to that, I would love to know, we're almost going to a conclusion as well.
Yes.
I would love to know, as you, there are some challenges.
Yeah.
You know, it has to be typical and realistic about the challenges young females and women as well face during trying to pursue the health profession. So you're going to tell us some of them and give some guidelines on how to overcome them, as also trying to inspire us, and I'm also being inspired as well. So to just help the audience as well.
Okay, thank you so much. About the challenges, should I say it like personally or?
Okay, of course, as you replying as a person, you're
Yeah.
going to mention some that you faced, and there are also some that are general, of course.
Yeah, so for personal challenges, most of the time, pursuing medical field, it requires you to be hardworking. You really need to work hard. You really need to give it your all. So sometimes you feel like, it's stressing, especially when it comes to pursuing, especially because in medical field you are saving lives, and so you have to be very competent. So sometimes you might be a little bit pressured, but what I can say is that you have to do self-prioritization and also be smart.
Like, you mean to prioritize yourself?
Yes, if you are studying and then you feel like you are tired, you need to rest and then come back. Because like if you're going to keep studying.
I have a question about the rest you're talking about. Should we resume the semester and we go try something else? Or we have to have some time for studying and also have some time to rest?
Yeah, I feel like it is in every school there is clubs, there are some sport activities. Please don't be stuck on your books only. Have time to study, have time to play, have time to go for sport, have time to go for clubs. So that, because like when you are only focused on one thing, sometimes it gets challenging. And also one of the personal challenge that I faced was gender bias. And as you can see, I'm very young. So even now, like some people might enter like in the consultation room and they say, so who is the doctor? And then I say, I'm the doctor. You? But you are young.
You look too young to be a doctor as well.
But what I can say is that being a medical doctor is not for old people. We really need to change that narrative. So being, facing biases that how are you a woman and how are you going to go for medicine? Will you be able to do it? I think it was one of also the challenges that I used to face. Yeah, but because I knew what I wanted, I was able to overcome it.
Well, I'm very sad that we're rapidly going to the conclusion, but I would love to know, first of all, starting from you, maybe you have your session to ask me as well. I want to know, in the name of you as a doctor and in the name of Rwanda Women Doctors for Reproductive Justice, what would be the last key message that you would love to address to the audience as well?
Okay, thank you so much. The thing that I want to talk about to all people who are watching us is that if you really want to become one of the healthcare provider, please be confident. Be confident, be passionate about it, and also keep in mind that if other people, you can also do it. And also to stakeholders, government, and other institutions, we really need to work together so that we can keep mentoring, inspiring young people, especially within this initiative of making sure that we are increasing the representation of women in healthcare profession. Yeah.
That's very nice. I'm also inspired as well. Do you have any question for me?
Yeah, as someone who hosted me today, and also as someone who is not, a doctor, what message do you think you can give to the audience so that they can be inspired to join the health profession?
Okay, thank you very much. And I think to the people watching me as well, and as answering you, first of all, know your passion. Know your passion, that's one. Don't be stuck.
Yes.
That's two. 3, have information, accurate information.
Yeah.
And after having the accurate information, go for it. After going for it, don't lose your hope or don't lose your focus as well. Because I'm also inspired to become a doctor as well, because sometimes some of the people outside the health profession or health career, we lose the typical inspirations, realistic inspirations, or inspirators as well. So I'm very glad that I came to know Rwanda Women Doctors Reproductive Justice, and I'm very glad of the support you guys are having from Rwanda Basic Education Board and related institutions. So I would say that to the person who wants to know or who wants to get to know what I got from this conversation as well. I think that's it. And that comes as to the closing of our podcast. Also reminding the audience to keep streaming this YouTube channel. It is Rwanda Basic Education Board. And also feel free to visit the website. It's www.reb.gov.rw. So also, I would love to thank Dr. Jose for the interesting conversation that we had.
Thank you to Apofi.
Yes.
And we also thank for the opportunity given by Ministry of Health and also Rwanda Basic Education Board to be able to share as Rwanda Women Doctors Reproductive Justice what we are doing to make sure that gender equity in health profession is really not just in numbers.
Okay.
Yeah.
Thank you very much. And don't forget to call the short code, which is 8016, and also to keep subscribing to our YouTube channel. Share it, subscribe, and make it broad away. Thank you very much for watching us. See you next time.